Welcome to the Dental School Guide podcast, your ultimate destination for all things dentistry. I'm Dr. Tanner Townsend, your guide through the complex world of dental education. Join us as we uncover the secrets of acing dental school admissions, navigating residency programs, and exploring career opportunities. Please share and enjoy. Real quick, just wanted to make all you pre-dental students out there aware of a resource. If you've ever been worried about getting into dental school or are wanting to get into that school of your dreams, then you definitely want to check out a program called Dental School Guide. In the program, we walk you through how to save money, time, and heartache when applying to dental school. There's so much fluff out there when it comes to resources for getting into school, and we are streamlining all of that. With our comprehensive digital course, expert mentorship, and personalized application review services, you'll have everything you need to stand out to admission committees. Take advantage of this amazing resource that will help you increase your chances of getting into dental school. You'll want to check out dentalschoolguide.com. Check it out. I'm your host, Dr. Tanner Townsend, and today we have the wonderful team of the admissions department at the University of Kentucky, and we are so excited to have each of these women with us today. So we're going to kind of go around the horn here and do some introductions so we know who's talking and kind of what their role is. But Rebekah, would you like to introduce yourself first?
My name is Rebekah Huff. My official title is Student Affairs Officer, but I am the pre-dental advisor and the recruiter for UK College of Dentistry. I'm kind of like the front lines person when it comes to everything dental school admissions. So I work with pre-dental students, not only from Kentucky, but from a little bit of everywhere. I do like individual counseling sessions. My job is that I just want to make every student that I work with the most competitive applicant that they can possibly be. So I work with them like individually. I do travel a lot, all over the state, all over the country. I've been to like Florida and Georgia and Arkansas this year. I meet with pre-dental clubs. I attend fairs. I typically go to the ADIA conference every year. So my job is that I just get to work with pre-dental students, and I'm very thankful for this job. I love it. I love the students that I work with. They're wonderful kids, and I just love helping them be the most competitive applicants that they can be.
I love it. All right, Missy, you're up. Let's hear it.
Well, hello, everyone. My name is Missy Shelton. I'm the Assistant Director of Admissions, as well as the Registrar for the dental school here. I've worked at the University of Kentucky for 27 years. About 20 of that has been in the Office of Admissions. This position is very enjoyable. Working with students from the pre-admissions all the way through seeing them graduate, because I work as the registrar. A lot of interaction in our office and with our students. I will also meet with students, not as often as Rebekah, but I also meet with students and advise them and provide some insight into their application, maybe how they could improve it or things they could work on. And then seeing them, matriculate and then graduate 4 years later. I am known in the office as the crier. So, at graduation, when I see people walk across the stage, I'm in tears because it's so hard to see them go and leave the nest, so to speak. So that's a little bit about me.
Love it. And Dr. Wright.
Hi, everybody. I am Dr. Allison Wright. I am the Dean of Admissions. I actually wear a lot of hats at UK. I am one of the team leaders. I do everything related to licensure exams, hand skill exam part of dental licensure. But as the Dean of Admissions, my job is really to facilitate and support what Missy and Rebekah are doing, and to try to just help streamline and advise as best I can to make sure that we get the best class each year.
Okay. Well, I am so glad to get to know all of you today and to learn a little bit more about what Kentucky has to offer and the wonderful things you guys have going on out there. So I want to give you guys this opportunity to kind of share with us what makes Kentucky great and what you feel has made Kentucky one of the premier dental schools in the country in helping students get the best education possible. So in your guys' mind, And I'm going to kind of pitch this question to all of you here. What makes Kentucky unique compared to other dental schools that you guys that have come across in your time?
I think Dr. Wright should respond to this from the clinical perspective first, and then Rebekah and I can always weigh in on the other things that we're looking for.
Okay, happy to. So, unfortunately, Kentucky is a pretty sick state. We've got a lot of comorbidities. We've got which then allows the University of Kentucky Dental School to have a huge population of patients that has a great dental need. So that helps the students because what they come out with is an education and a clinical application of that education that allows them to step into very rural places and feel very comfortable with what they're treating because they've done it before. They've seen those patients before. They've had to do it with faculty coverage in the clinic, but now they're out on their own, and there may be 150 miles before they have an oral surgeon or a periodontist or a different type of medical provider that can help them if they run into something. So they feel very, very confident in dealing with challenging, complicated dental patients, and they come out very well trained in that clinical aspect of dentistry because of that. There's not a simple MO, tiny little board prep filling that gets done. They're all huge amalgam fillings and crown preps and bridge preps and big things that you typically wouldn't expect a novice student to be having to get proficient at, but yet they do.
I love that. I think that is something that every student is aiming for, to be clinically proficient and be able to stand on their own when they leave school. So I think that's a wonderful thing that you guys are building there. Rebekah, Missy, anything to add to that?
I think one of the things that makes our school stand out, we do have one of the smaller class sizes in the country, so we do only have a class size of 65. There's a lot of perks of going to a smaller school. I know in the grand scheme of things that UK is a huge university, but we have a very small dental school. Our students get to know each other very well, and they tell me all the time, it's like they do become kind of like your second family. They build really strong relationships with each other. They are super supportive of one another. I don't see like cutthroat competitiveness among students. I see collaboration. I see a lot of working together, and I think they all just want to get to graduation together. And your fellow classmates are going to be extremely supportive of you. They want to see you succeed as well. So they're always willing to help, whether it's with each other or if it's something that our office asks. It's like, hey, do you guys want to help with whatever this is? And I always have a ton of volunteers. They're always so willing to help. And that's what I really love about our students in our school, is that they want to help us and they want to help each other.
I love
And
it.
I'll add to that our focus on service. When we're looking at applications, we have a holistic review, but if somebody isn't completely focused on direct service and building relationships with other individuals, so it's not like just volunteering at a homeless shelter or a soup kitchen. It's sitting down, maybe tutoring or a mentoring program, or being a little league coach, and they're building relationships with those other people. And so we have such focus on that in our application, we bring in individuals that have that focus as well. And so that's what leads to our having such wonderful classes. They meld so well together because they're not just worried about numero uno, they're worried about their classmates as well. And everybody lifts one another up and they come together, and it is, I've been told, well, we're not a family. Oh yes, we are a family.
Yeah, it's amazing how when students go through the rigors of the school together and they're not focused on themselves, how much that feeling of camaraderie of like, we're doing this all together and we're going to get this done together it's quite the incredible bond that you develop with your class. In terms of supporting students, like when they get out of school or they're leaving schools for the D4s that are going to be graduating, there's a number of students that kind of worry, like, well, how is the school going to help me either get into a residency program if I want to specialize or further my education, or help me potentially find a job after school? How do you feel like Kentucky does at using their alumni network and other connections to help students post-graduation find their next home?
Yeah, so we do have all, like, if they're looking to pursue a residency program, we do have 7 actually here in the building or the next building over. So everything is right here. And students do have the opportunity, like when they're going through the DMD program, to rotate through those specialties. So they get a little bit of a taste of it, they get experience, and then if they have like extra time, they can spend more time with those specialties. If one tends to interest them, they can go up there and be like, hey, can I help or assist or observe? Or our specialty programs are pretty open to students coming to do that if they want some more experience. And then we do have so we have a practice management course. So different like dentists will come in and talk about maybe their experiences with their practice or how they got into running their own practice. We do have things like a job posting board. I get calls regularly from practicing dentists who are letting us know that, hey, we have opportunities for maybe an associate, or we're looking for someone to buy our practice, and we hear that University of Kentucky produces excellent dentists, so if you could pass this along with our students, and we are happy to share that with them. So we have people practicing dentists calling us all the time asking for looking for students who are getting ready to graduate, or maybe who have already graduated who are looking for a job. So we do try to support them as best we can.
I
We
love
also
that.
have a very strong alumni club, basically alumni program, and they meet with the students, and then they have every year they have alumni meetings that are here and elsewhere within the state that they get people together. And so I know they reach out a lot with opportunities, like Rebekah was saying.
In terms of support for students, there are some students out there that are like, oh man, what if I end up struggling in dental school? Or like, is there going to be anyone there that's going to help me? Or can I get tutoring of some kind? What service do you guys provide for students that may be struggling in a class or not meeting expectations? And how is that student helped?
So we have a wonderful tutoring program right off the bat. Tutoring sessions are scheduled in our calendar, and students just have to show up. There is no, in the beginning, there's no mandated, reporting to tutoring. Generally, if students are struggling with hand skills, there is in-person hand skills in our simulation lab. Tutoring sessions are scheduled automatically for all of those commonly challenging courses, that students have struggled with in the past. We know it's going to be a struggle for some, if not all. So we automatically schedule those sessions. They are given, those tutors are students who have successfully completed those courses, very well in preceding years. Our restorative and PROS faculty, our team leaders, are responsible for designating students that are to be hand skills tutors. So they know those students that, have that gift and can perform that function well and relay that help to those other students that may be struggling, especially in their first year when they're just, getting things started. And then we also have a faculty advisor program. So we, in the one of the first things that students meet when they matriculate here is their faculty advisor. Most all of our faculty serve in this role, so they have a few students in each academic year to serve as that person's that students go to if they're struggling with a course, or maybe they're later in their academic career, they're looking for some career decisions or things like that. So they have somebody there to help with that. We also have a mentoring program, like similar to a Big Brother, Big Sister program from between 1 year and the next. So our current first year class, we already have 20 or so mentors that are serving as mentors to our incoming class. So we're very, and also knowing from the registrar perspective, we are aware of students that are struggling as they're going through the curriculum. And so our academic dean and our whole entire student affairs office is very on top of these things, meeting with students regularly that are struggling. That maybe course directors have shared with us that are struggling, and we reach out to them, connect them with individual tutors if the group tutoring isn't helping them. When we tell students, and it's the truth because I've been here for 27 years. When we matriculate a student, we plan for them to graduate. We don't plan any attrition. It's like we make sure we feel like a student can negotiate the curriculum when we admit them, and we're going to do everything in our power to make sure they progress as smoothly as possible through the program as they can.
Wow, that is very service oriented. I'm impressed. You guys have a lot of co-support coming from multiple different directions. That's wonderful. Dr. Wright, this is a question probably more for you. In the clinics, in the different teams, how many faculty are in there to student ratio once you're kind of in your team? And what does that typical clinic schedule look like for those third and fourth year students? Is it a morning and afternoon session? Is it a split kind of thing in terms of 2 sessions in the morning, 2 sessions in the afternoon? What does that typically look like for a D3, D4?
So we have second, third, and fourth year students that are in the clinic. Second years are in 2 clinic sessions a semester or a week. And then third years are in 4 sessions a week in the fall semester, 5 sessions a week in the spring. And then fourth years are in 8 sessions, both fall and spring. As a team leader, I have 13 second years, 13 third years, 13 fourth years. And I'm responsible for like patient transfer and assignments of those kind of things, and then helping them track what they need to graduate. But it's the fourth years that I predominantly work in the clinic with. That ratio, so I have 13 fourth years, but I don't have all 13 in clinic with me at any given time. I usually only have around 8. So it's about 8 to 1 as fourth years. As second and third years, it's a little less than that ratio. They'll have divisional care. So if they're working in operative, they've got restorative faculty covering them. If they're doing something pros related, denture related, they've got pros faculty, perio faculty do the same thing with all the perio procedures. In comp care, as a team leader, we kind of, fourth year, it's whatever needs to be done for that day in that chair. And fourth year purpose is really to help them put all the pieces together that they've learned from all the different disciplines and how that works to make you a general dentist, and to how do you put it all together to make it make sense. Didactics, I think it's a 65 to 1, right? It's 1 professor per class. But in the clinic, it's more, at the maximum, it would be about 8 to 1.
Wonderful. Sounds like a great experience that they're getting in terms of getting as much one-on-one help as possible. And 8 to 1 is a great ratio. Kind of switching gears here, let's talk a little bit more about admissions now and what you guys typically do in terms of admissions at University of Kentucky. So first, we've kind of already maybe alluded to the kind of person that Kentucky is looking for to admit to the school already. But who is the ideal avatar student that you guys want to have to come to the University of Kentucky?
So we, like Missy talked about, we do a more holistic review for admissions, and we will look at their entire application. And to us, there's no such thing as like the perfect applicant. Not everybody's application is going to look the same. I think we'd all be very bored if everyone's application looked identical. So I don't think we'd enjoy our jobs nearly as much. But when we review an applicant, we do have to make sure that they're academically capable. I'm not necessarily looking for perfect 4.0, perfect DAT, but we do have to ensure that they're going to be able to negotiate that curriculum and get through it. Especially when it comes to something like the GPA, we do look more at a grade trend as compared to what that overall number says. But we're looking for students who show those academic capabilities. We look for students who have a passion for the profession of dentistry. If we want to see students who have shadowed and spent time in an office and know that this is exactly what they want to do for their next 30, 40 years of their life. And I know Missy has talked about it a lot, but we truly go through and pick out and look for those students who have that passion for helping others. I tell every single student that I work with, whether it's individually or with a pre-dental club, if there is no direct service on your application, you will not be getting an interview with UK College of Dentistry. It is something that we take very seriously. We want those students who have shown that they have a passion for helping other people. As a dentist, you're going to interact with people constantly. We want to see that you have the abilities to do that, whether it's through tutoring or mentoring or coaching. We want to see those things that resemble that dentist-patient relationship. So we look very strongly at students who have shown that passion for helping others. And of course, we look at things like extracurricular involvement. We want to see like strong letters of recommendation, a really good personal statement. And I can think I speak for all of us when we say we're a sucker for the story. When we read a personal statement, we love the kind of stories that draw us in. And when we get to the end, we feel like we get to know the applicants. So we look at kind of everything holistically, but overall, we just academically capable, strong passion for helping others. Time spent in a dental office, knowing that, hey, this is exactly what I want to do.
So I'm going to dive a little deeper in a couple of things that you said there, Rebekah. I want to dive a little deeper on the story of the personal statement or their application, but also the service aspect. There's so many times that I hear, well, what kind of service are they looking for? Or like how much service, or like, do I need to stay with the same group the whole time? Does that look different to the applications committee? If we can get a little nitty gritty on the service part for a minute, let's kind of take it question by question. Do you guys have a certain amount of service that you're looking for? And is it a red flag to you if you're like, you see that student that does, oh, they only did service 4 months before the application opened up? You know what I mean? Is that a major red flag? Are they just checking the box? So I want to get your guys' take on that real quick, if you don't mind.
Yeah, so they should never just be doing something just to check the box. And whether that's service or anything on their application, it shouldn't just be checking the box. It should be things that they're interested in, passionate about, and things that they personally want to pursue. When we look at service commitment on an application, we want to see things that are long-term and ongoing. So, like, I'd much rather see somebody who had one or two things that they were really heavily committed to over a long period of time as compared to someone who had 15 different things that they did, but it was just like a week here, a couple of days here. We want to see some type of long-term commitment because you're not going to build a strong relationship with somebody if you just work with them for a day or two. So we want to see, again, those things that build the long-term relationship. Like, I know for my UK students, College Mentors for Kids is a very popular program that they're involved in. They're working with these children for a year or two, and they get to build that good relationship with them. So we want to see things that are long-term and ongoing, and not just deciding halfway through their junior year before they get to apply. It's like, oh, I should probably do something to, show the committee that I like helping others. I advise every student that comes in, I was like, you should have long-term service commitment. If that's not on your application, there's a very good chance that an interview is not going to be in the cards. So we really want those students who have that drive and passion for giving back and building those long-term relationships with others.
Missy, Dr. Wright, anything to add to that?
I think Rebekah covered that pretty well. It's definitely more about the long-term commitment than a week here and there. We want to feel the passion. We want to feel that this student is wanting to make somebody else's life better. And that's what I tell students when I meet with them. It's like, can you look back at the relationship that you've had through this experience and say, yes, I've made a difference in this person's life. They're better because I was there to help or advise them.
The only thing that I would add is that it shouldn't be something that it doesn't have to be an organized, I went to this place and did this. It can be mentoring their classmates. It can be working with a peer group. It can be something that they're already doing, but they just need to recognize and acknowledge that this is service, and then talk to talk to Rebekah, talk to Missy, and find out, because there's a lot of things that most of our applicants are already doing. They just don't know that they're doing it. And so it's nice to be able to say that, you went to this particular business and you develop these relationships with people, but not everybody has that kind of time to do it in a long-term feasibility for their schedules, or they've just come to the realization that this is what they want to do with dentistry and this is something that we're looking at, and so they didn't track it. They didn't have that on their radar as a freshman in college, that they needed to start and get going on it. And so we can help them find the things that they already had done in the past. And it because of what we're looking for, with it being direct service and that relationship building, it might be a little bit out of the box. It might be a little bit different than saying, I went to the food service, or I went to a homeless shelter, or I did this, that, or the other, because it's a little bit different what we're looking for.
Yeah, I think I see the same thing of there's a lot of students that have wonderful things they're already doing and they don't even realize that they're doing it. And it's just kind of thinking a little bit outside the box than the traditional food shelter, serving at my local food pantry kind of thing. So I love that. In terms of personal statement and story of the application, I think we see a wide range of different kinds of personal statements, those that are almost a resume when you read them versus the stories. But of the ones that have been your guys' favorites over the years, those stories that really bring and draw you in, what are some key common characteristics that those personal statements have that you would advise that every dental student should try to strive for in their personal statement?
I can see on Missy's face that she's probably thinking of the exact same personal statement that I am. So when I read a personal statement, I want to hear their story. Whatever it is that's, happened in their life that has brought them to this point, what has inspired them, what motivates them. That's what we want to see. And kind of like you said, it should not just be a resume or a brief summary of what the rest of the application looks like. We've already read that once. So I want you to tell me something that I can't see elsewhere in your application. A lot of students do end up writing about, what was the moment in your life when you decided that dentistry was what you wanted to do. Maybe they got all their teeth knocked out by a baseball when they were a kid, or Santa brought them the Play-Doh set that had the drill and fill, or maybe it was something completely different. Maybe they came to undergrad and started out in something else and realized this isn't what I want to do, and they shadowed around and discovered dentistry. And whatever their story is, I just want to hear it. The one that has always stood out to us the most, and I think this was maybe the first personal statement I ever read when I started this job back in 2018. They started theirs with, I am a human lamp. And I had not the slightest clue where that personal statement was going, but that person had gone on a mission trip and talked about their experience there and how they wanted to be the light for their patients. And they could have gone along the lines of told the story of the things that they did and they saw, but instead they talked about how it inspired them and how that made them want to become a dentist even more. So that was what drew me into that personal statement. And I use that example for every student or every meeting that I attend and speak to. That's the personal statement that I use as the example. I think that when we read a personal statement, when we get to the end, we should feel like we actually know that person now. So that's what I kind of look for. Do you guys want to add anything to that?
No, I agree wholeheartedly. And I know exactly the personal statement Rebekah is talking about. And those are the ones that stand out to us. It's like, we want to remember that personal statement so that we can share the tidbits of why that was so important to us with prospective students. And those that it's like I tried to provide some guidance on a personal statement. We had a workshop here a couple months ago, and I did a little mini personal statement workshop. I am no guru on personal statements, but with the amount of statements that I've seen, it's like I've shed some light, try to give some guidance. And it's about, drawing us in, like a good movie. You start that opening, and it's like, oh yes, this is interesting. I want to read more into it, and again, and not like what Rebekah was saying, and what you mentioned, we don't want to read the application again in the personal statement, and it's really just about showing us who they are. And it's really, it's not that hard. Not everybody has a wonderful, baseball knocked out all my teeth story, but they have something that woke them up to dentistry, and starting with that focus and bringing us into their story. And those are the ones that we really enjoy reading. And it's good when we cry, if it's very emotional driven, and it's like, oh my goodness, I have read it several that I'm like, I'm crying by the time I get to the end of it because I'm so brought into that story. And those are the wonderful statements to read.
I want to sit down and meet the kid. I'm excited for them to come
Yes.
to interview with us because I want to ask more questions. I want to know more. They've not just sold me on their application, but they've drawn me into the point that I really can't wait to meet them to ask them more questions. That's what I like in a personal statement. Not asking for a lot, am I?
No, you're very straightforward. I think yeah, people overcomplicate the personal statement. I think it just needs to just speak and tell your story. It doesn't have to be rocket science. All right, so in terms of that first review, you have all those applications that come in. How do you guys, if you're able to share this, score and determine who is going to be invited for an interview? Obviously it's holistic, but what does that kind of look like for you when you guys are determining who makes it to the batch of interviews?
So we each read, all of our applications are read by somebody in the admissions office. Everybody gets a thorough review. So we don't run reports and say, okay, yeah, this GPA isn't good enough. We're filtering that one out. We read every one because reports don't always show good grade trends. And so we don't want to say, okay, yeah, they're not capable of negotiating the curriculum when we don't. Maybe their last 3 or 4 semesters were nothing but A's, but they really bombed out their first 2 years, So we look at every application, and then we will decide on, based on that holistic review, academically capable, ready, building those relationships and spend enough time in the dental field that we feel their passion for dentistry. And 9 times out of 10, unless there's some big red flag somewhere, those people will move forward for an interview. But everybody in our admissions office will read applications. And I say everybody in our admissions office, that consists of the 3 of us.
I like it. Now, in terms of interviews, how do you guys structure your interviews when you guys come? There's so many different variations that we see from different schools. Some's a good cop, bad cop, like 2-on-1. Some of them are 1-on-1. Some of them are panel style, and some of them have their students interview them. And so we see a wide range of interview styles. How does Kentucky approach their interview?
The interview style is set up in a panel interview. We do have a dental student in the room as part of the panel, and it is always a 4th-year dental student. We have a staff member and then 2 faculty members. There is always somebody in the room that represents the admissions committee, because we do have a committee. And so there's always, whether it be a faculty, or sometimes I'm in the room, representing the admissions committee, admissions office as well as a staff member. So there's 4 people on each panel, and they interview each person for 20 or so minutes, and then that is the setup of the interview. We have sessions in the morning and in the afternoon. They rotate through they're either doing the interview, they're doing hearing a financial aid presentation, or they're taking a tour of campus. And they do those in rotation. They meet with our students for lunch. They come in the night before as well and do what we call a mix and mingle. Our students, we have 3 current students that are here representing our school, and they meet with the interview candidates for about 2 hours. And it's just a the applicant comes in and it's like, okay, ask the current student, now, why did you choose UKCD? And we're not a part of that. That is strictly students and our interview candidates, so that the candidates feel they can get a true answer, from the student. We don't want to be a part of that and have anybody feel like we're moderating the panel, so to speak. But that also, the mix and mingle provides a time for the candidate to find their way to the school if they're not familiar with UK, where they're going to park and how they get to the dental school, and just kind of we make it a relaxing evening for them. And then they come in the next day. They have a presentation with Rebekah. She talks about student life and some other things, other characteristics about our school. And then they go off into those rotations that I was talking about. And they have lunch with our students. And then the first group is done for the day. The second group has had the presentation with Rebekah and lunch with the students. And then they do the afternoon session in those different areas. And then they're done for the day.
Okay. That sounds like a very thorough day, which is wonderful. After you guys do the interviews, and it can be, obviously, I've seen multiple different things from different schools. I've even heard some schools saying they have PowerPoint presentations. They have 13 people in the room and they're arguing over who. Sometimes you got like one faculty pitching for a certain student. How does, just kind of taking back the curtain a little bit for these pre-dental students that sometimes are nervous of how the selection process goes, what does your guys' selection meeting look like? And are you having it multiple times during the cycle, or is it kind of a one-time, we meet right before decision day or in November before Thanksgiving, and then we discuss and make some initial decisions? How does that look for you guys?
We meet, the admissions committee meets about 4 times during the semester. We don't, we have like an introduction meeting, for the whole admissions committee to get together and get to know one another. Sometimes we have sometimes there are repeat members and sometimes there's brand new members. So we want to make sure our committee knows each other. And then we meet about 4 times throughout the semester to talk about our candidates.
Wonderful. In terms of advice that you guys have for students, especially pre-dental students that are looking to come to the University of Kentucky, what advice do you guys have, and it can be in anything, that you would recommend for students that we haven't already discussed in terms of being the best applicant possible for Kentucky? I'm sure all 3 of you have a few things that you've thought of in your communications with students previously, so I'd love to hear what your guys' thoughts are on that.
So when I work with students, just some general advice for them. I've seen it kind of happen a little bit more over the last several years, but I try to tell them that comparison is the thief of joy. And when they are applying to dental school, and like I talked about earlier, everybody's application is going to look a little bit different. And I know it's really hard not to compare yourself to others when they're thinking there's so few spots for so many applicants, and you yourself want to be the most competitive possible, but not everybody's application is going to look the same. And I try to tell them to, maybe not panic if you don't have as many shadowing hours as somebody else, or you maybe don't have as much of this as compared to someone. Maybe that person was not a student athlete and you were. Maybe I was a student athlete when I was in college. I know what it's like to spend a good chunk of your semester on a van going somewhere. Maybe that person had more time, or maybe you had to work 40 hours a week to support yourself through school and somebody else didn't. It's perfectly okay to run your own race. Not everybody gets into dental school their first try. Not everybody, decides to apply immediately after undergrad. It's perfectly okay to run your own race and focus on you, and everything's going to work out just how it's supposed to. So, but I wouldn't advise every student that I work with, focus on yourself, do the things that interest you, do the things that you're passionate about to make your application stand out, and it's all going to work out in the end.
Being unique is actually makes you stand out even more, and that's one of the things that we're looking for. And so I don't really want a class full of biology degrees. I would like to see them have varied interests. So we had a high school student that came through a tour with Missy last week. I think it was Missy. And I told him, I was like, what are you interested in? What do you want to study? What do you like to do? Focus on that, major in that. You've got to get the prerequisites, sure, to come, but it doesn't matter what your degree's in. Show your passion for whatever it is and enjoy college that way. And then it makes for a much more well-rounded class when you have that. You don't have everybody with the same kind of thought process. So then we can all benefit from the way somebody else thinks about something or approaches a situation. And then just bring whatever passion you have to general dentistry. You have to be a general dentist first before you can specialize. So focus on that. Get into different offices. Try to look at the way different people do things, because just because your father may be a dentist, that may not be the only way to practice general dentistry. In fact, there's a plethora of ways that we can do it. And so get into a bunch of different offices and then see different things and different ways to do it. And then just continuing to shadow and continuing to serve. Those are the best things that they can do to make themselves as attractive as possible, is just have a variety of options.
Yes, and I would agree with everything they've just said. It's a matter of, even for those students that are maybe didn't get in the first time and they're reapplying, we don't want to see that everything stopped with your last application. Stay active in those things that you're passionate about. Show us. It's like, well, if you stop shadowing when you apply to dental school, what is your passion about? Do you really have a passion? And it's very, I feel like that we have a very simple, qualifications to getting an interview. It's like you meet these things and you're somebody that we want to meet.
I like it. I think you all have said wonderful things that ring very true. So, and thank you once again for coming on the podcast. I've really enjoyed getting to know you all and to hear your guys' story and hear what University of Kentucky has to offer. So that is it for our episode for today for the Dental School Guide podcast. I really appreciate you all once again, and we will catch you all next time.
Thank you.
That's all for today's episode of the Dental School Guide podcast. We hope you've gained valuable insights and inspiration to fuel your journey into dentistry. Don't forget to subscribe to our podcast for more expert advice, inside tips, and engaging discussions. If you enjoyed today's episode, please leave us a review. It would mean the world to us. Until next time, keep smiling, keep striving, and remember, your dental dreams are closer than you think. Thanks for tuning in to the Dental School Guide podcast.